Alright, so the next thing I want to talk about are cranial nerves. We've already talked about spinal nerves, and as you guys know, there's 31 pairs of spinal nerves that innervate the spinal cord directly. Well, now we're going to talk about cranial nerves. And as the name implies, these cranial nerves are going to innervate the brain directly. So there's 12 pairs of cranial nerves, and the first two, the olfactory and the optic, innervate this region of the brain that we call the forebrain. This is the forebrain region up here. But other than that, all of the other cranial nerves are going to innervate the brainstem region. There's the medulla. There's the pons. And it's a little bit hard to see the midbrain in this picture, but all of the remainder of those cranial nerves, 3 through 12, are all going to innervate the brainstem region. Something else you might notice about these cranial nerves is that they're numbered, and specifically they're numbered with Roman numerals. So Roman numerals 1 through 12. So you have to know a little bit of a Roman numeral numerage there. And for the most part, the name of the cranial nerve is going to tell you either the structures they serve or what they do. So for instance, cranial nerve 12, the hypoglossal nerve. What does hypo mean? Hypo means below. Glossal refers to the tongue. And so the hypoglossal nerve is going to serve the tongue. Cranial nerve 3, the ocular motor. Oculo refers to eye. Motor means movement. And so cranial nerve 3 is going to innervate the skeletal muscles that control eye movement. Another thing to know about these cranial nerves, and there is one exception to this, is that these cranial nerves are going to serve structures of the head and the neck. Just like the spinal nerves serve areas of the body that are next to that part of the spinal cord, the cranial nerve, because it's associated with the brain, is going to serve head and neck structures. Now there is one exception to that, and that's the vagus nerve, cranial nerve 10. And cranial nerve 10, the vagus nerve, is going to wander on down into the thoracic cavity, into the abdominal cavity, and it's going to innervate a lot of the structures, the viscera down in there, but we'll talk about that. And one last thing that I want to point out is that cranial nerves are part of the peripheral nervous system. Remember, the central nervous system is the brain and the spinal cord, and anything outside of that is going to be considered peripheral nervous system. All right, so let's just go through these cranial nerves here and at least introduce you to them right here. And one thing that you may remember with regards to spinal nerves is that most spinal nerves are what we call mixed nerves. And what that means is that those spinal nerves have both sensory neurons in there. They're taking sensory information to the spinal cord, and they also have motor neurons. They're taking motor information away from the spinal cord. That's not always the case with cranial nerves. Some cranial nerves are mixed nerves, but others only carry sensory information. Others only carry motor information. So let's go through here and just take a look with respect to that. So here's the first cranial nerve, cranial nerve 1, and this is the olfactory nerve up here in the nasal cavity. And I'll bet you could tell me what type of information that's detecting. It's detecting exclusively sensory information. And so this is only sensory. It's only going to take sensory information to the brain, specifically sensory information related to smell. Cranial nerve number 2 is the optic nerve. Again, the optic nerve is only going to take sensory information to the brain. There's only sensory neurons that travel through the optic nerve. Then we get to cranial nerve 3, which is the ocular motor. And the ocular motor is only going to carry motor neurons. So this is only going to carry motor information away from the brain. And specifically, it's going to go to these eye muscles, these skeletal muscles around the eye that cause the eye to move. Number 4 is the trochlear nerve, and that's exclusively motor, also going to some of these eye muscles. Number 5 is the trigeminal nerve. This is a large cranial nerve, the trigeminal number 5. And this is going to be mixed. It's going to carry sensory information, to the brain, and it's also going to take motor information away from the brain. So this is a mixed nerve. Number 6, the abducens, is motor. Number 7 is another large cranial nerve, and this is a mixed nerve. Serves a lot of the areas of the face here. And so this is going to take sensory information to the brain, and it's going to take motor information away from the brain. Cranial nerve number 8, the vestibular cochlear nerve. This is associated with the inner ear, and this is going to be exclusively sensory. So we're only going to be taking sensory information to the brain through this vestibular cochlear nerve. Number 9, the glossopharyngeal nerve, glossotongue, pharyngeal throat. That's going to be a mixed nerve. And then here's number 10. This is the vagus nerve. And as you can see, the vagus nerve goes down into the thoracic cavity and into the abdominal cavity. And this is going to be a mixed nerve. So it's going to take sensory information from these areas of the body, take that to the brain, but it's also going to take motor information and bring that to these effector organs as well. Number 11 is the accessory. This is going to serve skeletal muscles in the neck and the shoulders, and so this is exclusively motor. Exclusively motor. And then we have the hypoglossal nerve, number 12, and this is also going to be exclusively motor. And just to emphasize this, but cranial nerves are super important. They innervate a lot of structures. So if you have damage to one of these, it can cause a lot of problems. And so as a nurse, knowing how to examine these different cranial nerves is going to be an important part of your job. And here's a YouTube video you can watch about that. We'll talk about some of this, some of the tests you can do when we talk about the specific cranial nerves. All right, so now I want to just go through these cranial nerves and just point out some of the highlights of them. So cranial nerve number 1 is the olfactory nerve, and these are exclusively sensory. So here we are, here's the nasal cavity. And what type of sensory information do we detect in the nasal cavity? Smell, all right? And so what happens, well, first of all, cranial nerve number 1, this olfactory nerve, it's not very long. These little nerve filaments right there represent cranial nerve number 1, the olfactory nerve. And so what happens is that you have these little chemoreceptors on the ends of these nerves, and those are binding smell particles, odorants, and that stimulates these nerves, and then that information is taken through this nerve towards the brain. And the next place that it goes is this bulb here called the olfactory bulb, and then from there it's taken to the brain by another set of nerves called the olfactory tract. Okay, but this little area right there is what represents cranial nerve number 1. How can you test if the olfactory nerve is damaged? Well, ask the subject to sniff and identify different aromatic substances, cloves, vanilla, stuff to that effect. Cranial nerve number 2 is the optic nerve. And as you guys can guess, the optic nerve is carrying exclusively sensory information here. What type of sensory information is it taking? Sensory information related to vision. So here you have the eye, and on the back of the eye you have this thin little film called the retina, and that's where all the millions of photoreceptors that are going to detect light information are located. So light information comes towards the eye, through the eye, hits the retina at the back of the eye, excites those photoreceptors, and then that information travels down sensory neurons through the optic nerve. So there's the optic nerve right there, and again, these are paired. So what happens is these optic nerves kind of move medially, and then they end up crossing. and they end up crossing at this location called the optic chiasma. And then what happens is the nerves are still intact. These are still the same nerves, but then they travel through a structure called the optic tract. So the sensory neurons travel through the optic nerve, they cross over at this optic chiasma, and then they travel through the brain via this optic tract. And guess where they're going? What are those right there? Those are thalami. Okay, so it's going to the thalamus. Then what does the thalamus do? Sends it to the appropriate location in the visual cortex. Cranial nerve number 3, the ocular motor nerve, the eye mover. So this is motor. These are only going to be motor neurons traveling through there. And you can see here it originates up there in the midbrain region, and then it comes down here and it's innervating all of these skeletal muscles that are associated with eye movement. And in fact, it's innervating 4 of the 6 what we call extrinsic eye muscles. So again, this is motor information coming through here, and it tells these eye muscles to move, and that moves the eye in the eye socket. This is all voluntary. There's also some parasympathetic motor neurons traveling through here. So we have some autonomic nervous system involved, specifically the parasympathetic. So there's going to be parasympathetic motor neurons traveling through this ocular motor nerve. But where are these going to innervate? Parasympathetic doesn't innervate skeletal muscle, it innervates smooth muscle. So it's actually going to innervate the iris here. And that's what this is showing down here. Let's see. There's the pupil, and the pupil is surrounded by the iris, and your pupil size is determined by whether or not the iris is contracting or dilating. And so the parasympathetic nervous system, the ocular motor nerve, is going to innervate these. And when you're resting and digesting, what do you want your pupil to do? Do you need a large pupil? Do you need a lot of light coming through? Or do you need a small pupil? And the answer is a small pupil. So what's going to happen is the parasympathetic nervous system is going to cause, there's actually 2 layers of smooth muscle here. It's going to cause this inner layer to contract, and that's going to constrict the pupil. So those are parasympathetic motor fibers doing that. If you suspected that somebody had damage to the ocular motor nerve, what could you do? Well, you could ask the subject to follow objects with their eyes, see if they could actually move and utilize these eye muscles here. And I suppose you could also shine a light in their eye and see if they, actually that would be the opposite. Yeah, we'll just hold off on that one. But I'm sure there's a test you could do for the smooth muscle here. I'm just not sure off the top of my head how you could stimulate that constriction. Yeah, actually you could shine a light in there. If you shine a light in the eye, then that should constrict the pupil. Number 4 is the trochlear nerve. Not going to talk a lot about that, but that is motor, and that's also going to these extrinsic eye muscles here. Then we have cranial nerve number 5. This is the trigeminal nerve. And the trigeminal nerve originates from the pons here, and here's the main trunk of it, and then there's 3 branches. There's what we call an ophthalmic division that innervates the eye area. Then we have what's called a maxillary division that innervates this area associated with the maxilla. And then we have a mandibular division that is associated with the mandible here. And this is a mixed nerve. And so these are going to be carrying, this is going to carry sensory information to the brain, and it's also going to carry motor information away from the brain. So what are some of the types of sensory information that it's taking? Well, here's an important point here related to that. These are the main sensory nerves of the face. So most of the sensory information that's detected on the face is going to travel through this trigeminal nerve. So information about touch, temperature, pain receptors, this is all going to travel through the trigeminal nerve here. What about motor fibers? There are some motor fibers here, and specifically they're going to innervate these muscles of mastication of chewing, for instance, the superficial masseter. And the trigeminal nerve, if you've ever been to the dentist and have a cavity taken out, the dentist is most likely desensitized part of this nerve, injecting Novocaine into the maxilla, into the mandibular regions to prevent that pain, that touch information from going to the brain. Number 6 is the abducens. This is motor, and this is also hitting an eye muscle in there. Okay, and number 7 is another large cranial nerve. Number 7 is the facial nerve, and this is a mixed nerve right there. It carries both sensory and motor information. And with regards to sensory, here's sensory over here, the sensory information that's traveling through there is going to be taste information. Okay, so information about taste coming from the tongue is going to travel through the facial nerve. What about motor? Well, most of the skeletal muscles of the face, except for the chewing muscle, are going to be, those motor neurons that innervate those skeletal muscles are going to travel through the facial nerve. So all of these skeletal muscles of the face here are going to be under the command of the facial nerve, or the motor neurons that are running through that facial nerve. There are also some parasympathetic motor neurons traveling through there, and specifically they're going to innervate the lacrimal glands or the tear glands, and also some of the salivary glands they're going to innervate as well. And you may have heard of Bell's palsy, because this cranial nerve innervates a lot of these, or most of these facial muscles up here. If you have problems with the facial nerve, for instance, Bell's palsy is, Bell's palsy is where you get paralysis of these facial muscles. And what happens, the reason that happens is because you can have an inflammation of the facial nerve, and this can be possibly due to a viral infection. And what happens is that if that's the case, then that can paralyze half the side of the face, and half of the side of the face ends up drooping down. Number 8 is the vestibular cochlear nerve, and this is strictly sensory, and this is associated with the inner ear. And the inner ear has two different things going on with it. It has what's called these semicircular canals up here, and it has what's referred to as the cochlea region here. So if we start with so not only is it the semicircular canals, but it has this vestibule region right here. And what type of sensory information is detected within the inner ear, specifically within this vestibule region? This is information about equilibrium and balance. So sensory information about equilibrium and balance is going to travel through this vestibular nerve, and then that merges into the vestibular cochlear nerve. So it's taken that sensory information to the brain. What about the sensory information coming from the cochlea here? This is where we detect sound. So sensory information about hearing is going to travel through this cochlear nerve, but then again it merges and forms the vestibular cochlear nerve. So this is exclusively sensory, and it's taking information about equilibrium and balance, and also information about hearing. It's taking both of that sensory information to the brain. Glossopharyngeal nerve. The glossopharyngeal nerve is a mixed nerve. And with regards to, let's see, sensory information, we're going to have taste information that's traveling from the tongue. There you can see detecting taste information. It's going to take that information to the brain. And with regards to motor information, it is going to innervate some skeletal muscles that elevate the throat during swallowing. But we're also going to have parasympathetic motor fibers that are going to run through there, and they're going to innervate one of the salivary glands, specifically the parotid gland. And that's this big guy here, the parotid gland, pretty superficial on the back of your cheek. And you can see that this nerve comes down there, and there's going to be parasympathetic motor neurons that stimulate that, cause the release of saliva into the oral cavity. So there's actually a few different cranial nerves that take information about taste to the brain, and that's what this is illustrating right here. Here we have the tongue with all of those taste receptors, those chemoreceptors on it. Those food particles dissolve in water, they stimulate those chemoreceptors, and then that sensory information is traveling through the glossopharyngeal, the facial nerve, and also the vagus nerve. All of that sensory information is going through the brain through those cranial nerves. So these are all sensory neurons, and they innervate the brain at the medulla oblongata there, or some of them do at least. At that point, they hit an interneuron, and that interneuron, guess where it takes that information? To the thalamus. Then it hits another interneuron, and where's that information going? It's going out here to the insula, the part of the cerebral cortex that integrates that taste information. Okay, and then we get to the vagus nerve. And the vagus nerve pretty much has a mind of its own. Okay, the vagus nerve, vagus means wanderer, and so the vagus nerve is it comes out of the medulla, and it does innervate some structures in the neck region, but there's also branches that continue on down into the thoracic cavity that innervate the heart, the lungs. Then it goes down into the abdominal cavity, innervates all of this digestive viscera right there. And this is a mixed nerve. And so this is going to be carrying sensory information from all of these areas to the brain, and it's going to be carrying motor information away from the brain. And with regards to motor information, okay, what type of effector organs are these here? Cardiac muscle, smooth muscle in the lungs, smooth muscle in all this digestive viscera here. What part of the nervous system innervates that? That's the autonomic nervous system, and specifically it's going to be the parasympathetic nervous system that travels through this vagus nerve here. If you remember from the autonomic nervous system material, the sympathetic nervous system originates from the thoracic and the lumbar region of the spinal cord, while the parasympathetic nervous system originates from the brainstem in the sacral region. So if you have nerves that are coming out of the brainstem and they're carrying motor fibers that are part of the autonomic nervous system, they're going to be parasympathetic motor neurons. So you have these parasympathetic motor neurons coming down here, telling the heart to slow down, causing bronchoconstriction, stimulating digestive activity. Cranial nerve number 11 is the accessory nerve. This is motor, and this is going to serve skeletal muscles in the neck and the shoulder region. The sternocleidomastoid that is responsible for lateral flexion of the neck, the trapezius, which is moving the scapula around. These are all under the control of the motor neurons traveling through the accessory nerve. And then lastly, we have number 12, the hypoglossal nerve. And the hypoglossal nerve is strictly motor in function. So you have motor fibers that are coming down there, and they're going to innervate skeletal muscles within the tongue and also skeletal muscles outside of the tongue. So this is going to allow not only to, if you can make little curls and all that stuff in your tongue, that's motor information is traveling through the hypoglossal nerve. Also moving the tongue around in your mouth, side to side, protrusion, retraction, all that kind of stuff. That's motor neurons innervating these skeletal muscles which command the tongue. So how would you test if you suspected there was damage to the hypoglossal nerve? How would you test that? Well, tell somebody to stick out their tongue, move their tongue from side to side in their mouth. And this is a nice little chart that summarizes that information for you.